Welcome to the Live to 110 podcast. I'm your host, Wendy Myers, and today we are interviewing Dr. Terry Wahls. I'm really excited about this interview. Dr. Terry Wahls has healed herself of multiple sclerosis. She was once a marathon runner and a mountain climber, and she was diagnosed with MS and was soon confined to a wheelchair. Dr. Wahls had already relied on drugs and surgery to treat her patients, but found that as a patient herself, conventional medicine was failing her. So determined to find a cure, Dr. Wahls switched from a vegetarian to a paleo diet and began various therapies to reverse her symptoms to the point where she was able to walk without a cane and even bike 18 miles in one day. And her new book, The Wahls Protocol, How I Beat Progressive MS Using Paleo Principles and Functional Medicine, details her extraordinary findings in her recovery and provides a step-by-step guide to regain control of your health while living with autoimmune disease. Please keep in mind that this program is not intended to diagnose or heal any disease or health condition, and this podcast is solely informational in nature, so please consult your healthcare practitioner before engaging in any diet or regime that we mention on the show today. And Dr. Wahls is a physician and a clinical professor of medicine at the University of Iowa Carver College of Medicine in Iowa City. And she is the only doctor who is testing the paleo diet in a clinical setting to heal disease, namely autoimmune and MS. Dr. Wahls' book, The Wahls Protocol, is details about how to address the underlying cause of disease by employing a nutrient-dense paleo diet, a supplement plan to feed the mitochondria and increase the body's energy. She is also using exercise, detox, and other therapies to heal the body of disease. What I love most about this book is how it puts the care in the hands of the patient and disease firmly under their control and empowers them to get their life back. So Dr. Wahls, thank you so much for coming on the show.
Oh, thank you. I'm thrilled to be here.
So why don't you tell the listeners your story? You have a very compelling story.
So I'm a clinical professor of medicine. I think alternative medicine is a bunch of hooey, and I'm very into drugs, the latest findings in the New England Journal of Medicine. In 2000, I'm diagnosed with MS. I decided to treat my disease aggressively, so I go to the best MS center I could find, the Cleveland Clinic. And within 3 years, my disease has progressed to secondary progressive MS. And in that phase, there's no more remissions or improvement, steady decline. They tell me functions once lost, gone forever.
Yeah.
I get the wheelchair that was recommended. I took mitoxantrone, a form of chemotherapy. I took Tysabri, a very potent immune suppressing drug, about $42,000 a year, and continued to decline. That's when I started reading the science and began my self-experimentation, because it was clear I was headed towards a bedridden, demented life. Yeah. The Wahls Protocol details that journey, how I discovered paleo medicine, how I discovered functional medicine, how I had the insight to combine them so that I had this long list of nutrients, not from synthetic sources, but I redesigned my diet using paleo principles to get them through food. And I added, resumed my meditation, did exercise, electrical stimulation of my muscles. So big lifestyle change. Within 3 months, I can walk with a cane. Within 6 months, I'm walking throughout the hospital, no cane.
Wow.
And at 9 months, I'm able to do an 18-mile bike tour with my family.
Wow.
And, my family and I were crying because I had come to terms with I was going to be disabled forever. And I really had to, do that 18-mile bike ride before I understood I was breaking all the rules. Who knew what was going to happen? And it obviously changed how I view disease, how I view health, changed my clinical practice, and it changed the focus of my clinical research.
Yeah, so your book focuses on healing autoimmune disease like MS.
Yes.
And today it's estimated that 75 million people either have a diagnosis or they have the antibodies for autoimmune just at a subclinical level. But what exactly is an autoimmune disease, and why is the prevalence of these diseases increasing?
So our immune cells have the ability to, when they're going around inspecting all of our 1 trillion cells that we have, they can decide, okay, that belongs to me, it doesn't belong to me, and I need to attack it. And what has happened is that for reasons that people don't quite know, some prior infection altered our structures in some way that the immune cells, when they approach it, now see it as a infecting organism and begin attacking it. So with MS, they're attacking my brain and spinal cord. With rheumatoid arthritis, they're attacking joints. With lupus, they're attacking the cells themselves. Why are we having more? I think we have several clues. One is the dramatic intake of sugar. In 1700, we had 10 pounds a year. In 2000, we have 100 pounds a year. That's really increased the leaky gut, where the gut lets incompletely digested food into the bloodstream, triggering an immune response. Dr. Fasano wrote a great paper outlining that the leaky gut is the first step in developing autoimmunity. Yeah. Another thing that really revs up the autoimmune problem are lead, mercury, arsenic, plastics, heavy metals. And of course, we're in an increasingly toxic environment. The diet quality has declined, so people's ability to process, eliminate those toxins have also declined, further increasing autoimmunity. Yeah, for MS, I believe the incident rate's up 400% in 15 years, and we now have children as young as 6 with MS. Yeah. And this was a disease that was not described before 1836, I believe.
Yeah. Yeah, it's I've read that it's one of the fastest growing subsets of diseases in the world.
Yes, it's diet and lifestyle related. We have thousands of papers that show us the genes account for maybe 5%. If you happen to have 2 parents with MS, it may get up to 30%. Always, it's the diet and lifestyle that accounts for 70 to 97% of your risk of MS.
Yeah, and doctors aren't telling their patients this. They're just telling them, oh, there's nothing you can do except take drugs, and you just have to live with it.
And too many of our docs don't realize that epigenetics are the big driver, and the epigenetics are diet and lifestyle.
Yeah, yeah. So how did you come up with your protocol, and how quickly did you use the various therapies in your protocol? How quickly did you recover?
So here's the sequence. Diagnosed in 2000. 2002, my Cleveland Clinic neurology doctor told me about Lauren Cardane. I got the book, gave up being a vegetarian, began paleo. Still declined. 2003, hit the wheelchair. 2004, I start reading the mouse and rat studies and started adding vitamins and supplements. I slowed down the steepness of my decline, so it's a little flatter. Very, very grateful, but still declining. 2007, I discovered electrical stimulation of my muscles. I convinced my physical therapist to do that when I exercise, so I get more oomph from the exercise. And then at the same time that I'm discovering E-STEM, I discovered the Institute for Functional Medicine, and I take their course, a functional medicine approach for common and uncommon neurologic syndromes. Deepen my understanding, I have a longer list now of about 20 vitamins and supplements I'm taking. I add those, and with the E-STEM, what I see is maybe just a hint of improvement.
Yeah.
And then I have this brilliant awareness, like, I should get all this stuff in the food that I'm eating. So I go talk to my registered dietitian friends. They like, we don't know where it is. I go to the health science library. They can't find the text. But the University of Google. So, more research. It takes me a month. I have my new food plan stressing these nutrients.
Yeah.
And so just a month. So I do this in December. By the end of January, my mind is so much more clear. My energy's improved. I have to stop my Provigil because I can't sleep at night because I'm no longer fatigued.
Yeah.
Then the next month in February, I start walking with a cane. And people are like, oh, Dr. Wahls, like, oh my God, you're walking. Then in 6 months, I'm walking without a cane.
Yeah.
And at 9 months, I'm on the bike. So this whole thing went from 2002 to 2007, but I've continued to learn. We've modified the protocol, and I discuss that in my book, how I've changed things from what I did back in 2007, 2008.
Do you feel like your vegetarian diet contributed to MS?
So, as a tender-hearted farm kid, named all of my animals, even the ones we were going to eat. So I was very happy in high school to be a rebellious teen on the farm and say, no meat. Yeah. I had no idea that B12 was going to be a problem. Even though I went through medical school, somehow, as a vegetarian then, I don't know how I missed being told that I need to pay more attention to the B12, be more careful about the protein consumption. I was probably had too many carbs. I had a lot of antibiotics as a kid. I'm sure I had a yeast overgrowth. All those carbs were a problem. Inadequate B12, a problem. Probably not enough protein, a problem. And I'm also know I wasn't tuned into the omega-3, omega-6 fats.
Yeah.
So that was a problem. So while it may be possible to do a vegetarian diet more safely, and I give people guidance on how to do that, I clearly had not.
Yeah.
And so for me, the way I chose to do my vegetarian diet was another part of why I became ill.
How long were you vegetarian?
Oh, from high school to about 2002. So 20 years.
Wow. Yeah.
I was a vegetarian, and I ate some fish now and then during that time period. Then I would go back to my vegetarian ways.
Yeah. I have to say, many of my clients, the sickest ones are the ones that were long-term vegans or vegetarians. It's tough to do correctly. You have to really know what you're doing.
It's very hard to do correctly. I know too many people who quit eating meat, like I did, without understanding the intricacies of how to create a safe diet. Yeah. So I see vegetarians eating a lot of white flour, sugar, no protein, no vegetables. They're clearly going to be in trouble.
Yeah.
I do see vegetarians and vegans who get the vegetable part right, do that really well, detox, feel great for 2 years, and then when they run out of their B12 and their minerals, then they start deteriorating, and they can't figure out why.
Because you run out of B12 in 3 to 5 years, correct? And you can get permanent neurological damage.
That's when bad things are happening to your brain. There's a lot of neurobehavioral problems, and people, because they felt so good initially with their vegetarian diet, vegan diet, they have a really very hard time grasping that their diet may be contributing to their problem now.
Yeah. And so can you briefly explain the Wahls diet that uses paleo principles?
So what I've done is use the paleo principles, so there's no gluten-containing grain. If you have gluten-free grains, it's only 1 serving a day. No dairy. I also take out eggs because of the high risk for food sensitivities there.
Yeah.
Then we structure it. So you have 9 cups of vegetables. And this is for a man or a tall woman. I'm 6 foot tall. Mm-hmm. Short women, petite people will need proportionately less.
Yeah.
So it's 3 cups of green leaves, cooked or raw, 3 cups of sulfur-rich family vegetables. So that's cabbage family, onion family, mushroom family. And we use those because of the impact they have on inducing enzymes in the brain, in the liver and kidneys. And then 3 cups of deeply colored, pigmented stuff, beets, carrots, berries. Protein to appetite within the range. We're looking for about 6 ounces to 12 ounces, according to size and gender. And I'd like to have some omega-3 fats in there as well, either 2 tablespoons of vegetarian sources or fish oil, depending on what the person is doing. Mm-hmm. And then as you advance along, I move people. So at the entry-level diet, I speak to the vegetarians and say, you can do this as a vegetarian or vegan. These are the principles and the concepts to improve your nutrient density, reduce your food sensitivity issues, reduce the phytates and lectins. So I give them some directions for them. And then the next level is the Wahls Paleo. We talk about organ meats. We talk about seaweed. We talk about sprouting nuts and seeds. And then the next level, we further reduce the carbohydrate intake. And now we're going to add more fats, particularly medium chain triglycerides, and I'm putting people into ketosis.
Yes. And how is that important for people with neurological issues?
So for millennia, humans were in ketosis every winter, every war, every famine. And it turns out our brain runs just fine on ketones. And so do our muscles, so that we can be very adapted to being a fat-running machine. And we've known since the early 1900s that putting people in ketosis reduces seizures and improves brain performance. Now we have a bunch of studies going on looking at a variety of psychiatric and neurologic diseases using ketosis to reduce inflammation, improve healing. And here at the University of Iowa, we have a bunch of studies using ketosis to treat cancer. What I did that's unique in my ketogenic diet is we put people in ketosis, then we also measured to be sure that we were still having enough of the carbohydrates to get the 31 nutrients that science says are really important for the brain. Because many of the ketogenic diets, short-term get people into ketosis, do a great job, but they'll be like the vegans and vegetarians. If you aren't fully nutrient replete, at 3 to 5 years, you're going to be running out of stuff.
Yeah.
Then your health will be declining. You'll be going back, well, I felt great when I was in ketosis. I'm sure it's not my diet, without realizing, again, a ketogenic diet's like a vegetarian vegan diet. It's very hard to do correctly. You have to really pay attention to make sure you're getting all your vitamins, minerals, essential fats. And the medium chain triglycerides help, and the structure that we provide help people do that much more safely.
Okay. Yeah, I had one question about the diet because many other people are talking about how if you should be avoiding nightshades if you have autoimmune. So why is it exactly that you recommend that people can eat tomatoes and red bell peppers?
Great question. Thank you so much for asking. So the first thing I did was focus on nutrient density to get those 31 nutrients in. Then I took the top 3 for food sensitivities, gluten, dairy, and eggs. And I have people do that at level 1. Then in the book, we talk about, okay, if you're not doing well, you can move on to the Paleo Plus or the Paleo and Paleo Plus diets. But then I also list, here are the other food sensitivity problems. Tomatoes, peppers, eggplants, potatoes, soy. And then acknowledge that for many, we need food sensitivity testing, such as an LCAT or mediated release test, or the antibody test, to personalize this. Because while nightshades might be a problem, broccoli or shrimp or strawberries might be a problem.
Yeah.
And so I think personalization is really the best. When I wrote the book, I worked with my in our study. We worked with our registered dietitians. It's very important to be as least restrictive as possible, and then have a plan to stepwise add more restrictions to your diet or more study to understand what restrictions are necessary. I take issue with those who interpret the paleo message to have a long list of things you can't eat, and that leaves people at risk for micronutrient deficiencies.
Yeah.
I think they'd be much better served by having a food sensitivity assessment, either with an elimination diet that's done formally, food allergy testing through blood work, stool work, or the LCAT mediated release test. So it can be very specifically personalized.
Yeah, I agree. There's no reason to exclude foods if you don't have an issue with them, if you don't have personally. So you don't feel that these nightshades, the tomatoes and peppers, can contribute to autoimmune?
Well, they may.
They may.
But so may broccoli, so may shrimp.
Okay.
So any of the food that we eat could. I prefer a stepwise introduction, maximize nutrient density, take out the worst offenders, heal the leaky gut, see how far you get.
Okay, yeah.
Then you may need to think about taking out nightshades.
Okay.
What I'm impressed with in my clinical practice, twice, people have told me they do better without nightshades. Yeah. Otherwise, I'm seeing superb results with healing the leaky gut, just doing the gluten, dairy, and eggs.
Yeah. Yes.
But they have to be individualized.
Yeah, absolutely. Absolutely. So clearly you encourage getting the majority of your vitamins and minerals and other nutrients from food. So why is it necessary to supplement today, and what supplements do you recommend on your protocol?
So if we look at the mineral content of the soil, apparently we've had about an 85% decline over the last 100 years, according to USDA reports. Probably because of lack of crop rotation and the use of chelating fertilizers and herbicides like Roundup. And if you measure the vitamin mineral content of an apple, I think it was chicken and beef, they document, again, from 1919 to 1992, a 20 to 100% decline in either the vitamin or mineral content. So the nutrient density of our food, even if we're eating all those vegetables, is less than what our parents, our grandparents, and our great-grandparents ate.
Yeah.
Now, the foods that haven't been as diluted are the things that aren't sweet. Yeah. So your greens are still nutrient dense, your spices are still nutrient dense, your sulfur-containing vegetables are still nutrient dense. Your colors will be a little less nutrient dense than they used to be. So that's part of why when we've designed our diet and I've done the analysis, we still have incredible nutrient density in our food. Having said that, certainly we can identify people with autoimmune diseases, mental health problems, heart disease, are more likely to have enzymes that are less efficient at metabolizing B vitamins, less efficient at how we handle sulfur. So for that reason, a B complex may be, and I suggest this in my practice, if you got a family history of bad heart, bad brain, B vitamins are probably your friend.
Yeah.
And you likely had problems removing toxins. Therefore, the 9 cups will be your friend, and maybe some sulfur amino acids to give a little bit more support as well. Then we'll talk about vitamin D. Very, very important to know what your level is and get it. My perfect level is between 80 and 100, but you could live with between 50 and 100. But to get there, you really need to follow blood levels to know that you're getting there. And then I like to have a sense of the essential fatty acid ratios in terms of omega-3, omega-6. You can get that through a cell membrane analysis and then really know. I talk about some other primary care ways of assessing that.
What do you think about TMG or trimethylglycine to add some methyl groups to help people to detox?
I have not used that.
Okay.
I can't comment to any personal experience. Okay. I think certainly the B vitamins, methyl B12, methylfolate, very, very important. And for some, that may be very helpful.
Okay. Well, just like you, I'm a huge proponent of detoxing heavy metals, and I see them as a major underlying cause of disease today. I personally use hair mineral analysis to test for metals, but of course people have to do a detox program long term to see all the metals coming out. It doesn't show on the first test. So how do you test for heavy metals and detox yourself and your patients?
So interesting. So I'm 2 years into my recovery, and then I'm thinking, I wonder... I know I must have been toxic, so I do a 24-hour heavy metal, and it comes back diffusely positive. I'm like radioactive. I've got thorium, thallium, uranium, and I think there were just 4 metals that were not in the toxic range. So this is 2 years into recovery. I'm walking around, biking, feeling immensely better. I make a few adjustments on my protocol, up the seaweed and algae, by the way, and so 2 more years later, so now we're 4 years into my recovery, I repeat and everything's out. So that's my personal healing story. In our clinical trial, we're doing 24-hour heavy metals in the beginning and again at 12 months. And what I saw, I expected people to decline, and what we're seeing is they're actually increasing. And the reason I think that happens is when you're heavy metal poisoned, you can't get the metals out very effectively.
Yeah.
And so you have to resuscitate the person before the metals will begin to spill.
Yeah.
So we resuscitated them, got their enzymes working better, fed them appropriately, and now at 12 months, they have diffusely more stuff in the urine. And then we do a very careful history. What are your exposures? Could we have gotten some more into you unwittingly? And then most importantly, how do you feel? How's the energy, quality of life? And our conclusion is the change is probably a reflection of resuscitation of the enzymes, not an introduction of more toxin into them.
Yeah, I find that with my clients as well. Once we get them on the right diet, tons of vegetables, good supplements, minerals, then the body releases them after 3 to 6 months or so, but it doesn't start releasing them before that typically. Like you said, you got to resuscitate them. I love that word.
Got to resuscitate all those enzymes so they'll work.
Yeah.
Absolutely.
So do you use infrared saunas to help detox your patients?
So MS folks are, heat really makes the MS symptoms much worse. So in my clinical trial, no. In my personal practice is interesting. 9 months into my recovery, I could tolerate heat and got a sauna and started adding regular saunas to my regimen. In my clinical practice, we do talk about sauna as and sweating as a adjunct to detox. And I talk about clay and zeolite as well.
Okay. So do you find that even if the MS patients are sensitive to that and it increases their symptoms, do you find that might be a necessary healing reaction, so to speak, to get them detoxed so that they can recover quicker? Or do you prefer to wait until they can handle it better?
I don't put them in heat until they feel like they've recovered.
Okay.
And then I have them do a test session just to see how well they will tolerate it. And some people haven't, like me, recovered their heat tolerance and have added saunas and are doing extremely well. Those who are not, then I stay with the clay, zeolite, and gentler forms of detox.
Okay. Well, why don't you tell? Well, I want to talk a little bit about your clinical trials. Can you tell the listeners a little bit about some of the research that you're currently conducting and what prompted you to do them?
So, one case recover, people say so what? And I've seen clinically people were doing extraordinarily well. My dean of the medical school helped me assemble a team to design a clinical trial. To everyone's surprise, including mine, I was quite successful at getting funding from a private foundation in Canada. So we were answering the question, could people do it, this complicated regimen? Was it safe for them? And if they did, what happened? And this was such a radical new way of treating MS. Our institutional review board that does the oversight said, you know what, do 10, give us a safety report, and then we'll decide if we can let you do the rest of your study. So we did that, and of course our safety report was very good, and we got to enroll the rest of the folks. We've now published the first 10, and we show that, yep, people can do this. The biggest problem is that if you're overweight, you lose weight without being hungry. That's the biggest side effect. And fatigue is extraordinarily difficult to treat for MS. It's the #1 reason why people become disabled. And the fatigue severity scale goes from 7, total fatigue, to 1, no fatigue. The FDA has approved the drug Provigil on the basis of a 0.5 improvement, which clinically is not much. I took Provigil for many years. It doesn't do much, but you're so grateful to have even that tiny amount. Yeah. So people are happy to take it. In our trial, people started at 5.7, so really quite fatigued, came down to 3.9. There is no other paper that has reported that level of improvement. And we see the other thing that we observed is after people, if they stopped the protocol, their fatigue shot back up just as high as it was before.
Yeah.
So we're making it very clear now in that second group that's coming through that from our perspective, this is a new way of living. This is not a diet. It's not a lifestyle. This is a new way of living if you want your cells to be healthy, vibrant, and to be getting your life back.
Yeah, I mean, your protocol sounds very similar to the principles that I've studied for years to figure out what works and what doesn't and what should I adopt. And it's definitely something I think that anyone can adopt to heal their body of any imaginable symptom. They need to right diet, right supplements, detox, etc. So your book's very focused on autoimmune, but can this heal other diseases and symptoms as well?
That's a great question. So I have thousands of followers. Hundreds of people have reached out to say, I'm using the Wahls protocol, and it's helped this. So Parkinson's, early cognitive decline, fibromyalgia, depression, and a variety of psychiatric problems. And then, of course, the obvious obesity, diabetes, other autoimmune conditions, inflammatory bowel disease, lupus, rheumatoid arthritis, asthma, psoriasis, eczema. and then a whole bunch of autoimmune diseases that I'd never heard of before, I might add.
Yeah.
They're like, okay, I guess this is autoimmune now.
There's a lot of them. There's a lot of them.
And every year we're adding, tons and tons. I expect that ultimately we'll realize that all of our chronic disease is, at least in some capacities, autoimmune. For example, heart disease is now being studied as an autoimmune condition.
Yeah, I was about to say that. They now think that atherosclerosis is autoimmune.
Is autoimmune. High blood pressure is really an autoimmune condition. So is schizophrenia.
Yeah. Mm-hmm. Yeah.
So I think in another 20 years we'll realize that all of our chronic lifestyle diseases have an autoimmune component.
Yes. Yes. Yeah. So can you tell the listeners a little bit more about yourself and where they can find you?
Sure. So please go to my website, Terry, Terry, Wahls, WAHLS.com. We have a lot of materials that you can download that were mentioned in the book. And if you have MS and you have fatigue and you want to hear more about our clinical trials, because we are still recruiting, call my secretary at 319-356-4421, Arlene. So that's 319-356-4421.
So what if someone wants to see you privately? Do you have a private practice where clients can see you?
Sadly, no. All of my clinical time is at the Veterans Hospital, and that's where I see traumatic brain injury and a therapeutic lifestyle clinic with very complex chronic medical issues, many autoimmune problems. I do not have a private practice, unfortunately.
Okay. And so everyone, thank you, Dr. Wahls, thank you so much for coming on the show. That was so informative, and I was just very honored that you came on my podcast, and just thank you so much.
Thank you. I'm very glad to be here.
And everyone, if you want to learn about detoxification, the modern paleo diet, or healing your health conditions naturally, you can go to my site, live to110.com. And definitely go check out Dr. Terry Wahls' website. Her book is amazing. I read it cover to cover before we did the podcast. I started to read it just to do the questions, and I just ate it up. It's an incredibly informative book, and there's a lot of details about the diet that I think are really good nuances to make, and something that you should definitely be adding to your plan to live to 110. So everyone, thank you so much for listening, and thank you, Dr. Terry Wahls.
Thank you.